It will be.
Matthew Perry, how are you doing today?
Hey, Brianne, I am doing wonderful. We have, I always talk about the weather here because I'm lucky and I pay enough for it. We got
That you
good
do.
weather. It feels like summer here in sunny San Diego. Absolutely no complaints. Getting through the week and trying to enjoy things along the
There you go.
way.
I love that because yes, you do pay for your weather.
Yes, yes, in exorbitant amounts. But it's all good. It's all
Oh my gosh, that's awesome.
good. For those, I'm sure most people who are listening understand California. They call it the sunshine tax and all that. I'm sure similar to Florida. Um, I'm fortunate that we don't have to worry about hurricanes, any of that kind of stuff, because that would freak me out.
Right? Well, you have earthquakes.
We have earthquakes. It's so funny. Bringing just real quick, like being in California for most of my life, I see people coming from outside of California and they're freaked out about earthquakes. Like, oh my God, I need earthquake insurance. I need this. And that. It's just, it'll happen. And, just get in a doorway and you'll be okay. Everyone's like, why are you so calm, Matthew?
No, it's really funny. So my here's like I have this really weird fear of why I don't like ever want to be in an earthquake. Like I'm afraid that I'm gonna be standing at where like the ground opens up and fall into the big crevice.
Oh, yeah, like the movie, like earthquake kind of stuff.
Like this is my fear of an earthquake.
You just go boop down below. Okay, maybe that kind of piqued a little fear of mine too. Any seismologists or anything seismologists who are listening, please reach out to Brianne and dispel that the likelihood of that.
Yes, that'd be great. That'd be great. I don't avoid California, but I don't want to live there because of that.
You go visit every now and again.
Exactly. Awesome. Well, on that note, this podcast is not to talk about earthquakes and the weather. So let's dive into what we did want to talk about today. And I think let's actually start with what you kind of brought up, Matt, as far as the chasing pain conversation. And I think, which I totally understand, like people have pain, they want to be out of pain, and that's kind of the main focus of anyone, which rightfully so. Like that's what keeps you from being able to do what you want to do. It can be what keeps you from being able to sleep, all those things. So it makes sense that we want to get rid of the pain. But I think a lot of times it's like, oh, I have pain here. Okay, let's calm it down. Oh, and now I have pain here. Okay, let's calm it down. And we're just like essentially chasing pain rather than actually like figuring out what's going on with things.
Yeah, absolutely. It's been kind of a common theme, especially over the last few weeks. It's really, stuck out. It's this whole like, you go to a restaurant and you ask for the soup du jour, right? Soup of the day. I don't know if that's a literal translation, but and I think most people know what I mean. And the same thing happens with our pain, right? You come in one day, oh, my elbow hurts, and then you come in the next day, oh, my wrist hurts, oh, the next day, my shoulder, and I first, as you did, want to really validate people's pain, and that's a real thing, and where they hurt is a completely real thing, but I feel that our expertise and kind of our role in our patient's care is not to be chasing symptoms and stuff like that. I feel like most people can do that very sufficiently via YouTube or whatever. My wrist hurts today. Look up some wrist exercise, right? That kind of stuff. But it's to get to the bottom of their pain and to try to resolve it, make sure it's not happening, anymore. Right?
Absolutely. I mean, you and I both want to make a living, and we do that by working with injured people. But at the same time, it's like, I don't want to see that same person every day, every week for the rest of my life. Like I want them to be able to not see me for years at a time and only come back when it's like, oh, you know what? I fell down the hill and broke this or, whatever. Like, I'll see you when you injure yourself again because of a trauma. I don't want to see you because, oh, my Achilles is hurting now, and oh, now my hamstring's hurting, and just going through these patterns.
Yeah, because they're all the lower body injuries are great, because they're typically symptoms of a bigger problem and a central problem. And I tell my people, hey, you can come in and see me if you like. Hey Sue, I love your cookies. Please come in every, during Christmas time and bring some cookies and stuff. But I don't want you seeing me because you have to. And yeah, if we're treating someone for their Achilles issue, and then like you said, a year later they fall down a hill or whatever and hurt their shoulder, two independent things, right? But chasing, symptoms that are obviously, a bigger problem, no, we need to do a little bit better than that. We can work on palliative care, and when they hurt themselves, can we give them a little program to, like, okay, if your hip hurts, this is kind of what you do. If your knee hurts, this is what you do. But our goal is to deal with the whole person and the overall underlying issues.
Yeah. And one thing I do want to point out too that came to mind as you're talking about that, after I said, I don't want to see people forever for the rest of my life, is like still the importance of maintenance. Like, I know I go to my massage therapist once a month because I know with my training, I need to loosen things up. And I think it's important for the physical therapist as well. And, maybe even the chiropractor, depending on that chiropractor. But I think it's our bodies, because of postures we maintain, habits we've maintained, we get stuck in some different patterns. We get, maybe you just rolled your ankle a little bit, we're able to run it off, feels fine, but there might still be a little bit of a stickiness restriction in there. Like just seeing someone once a month for just kind of like, let's just look over everything, make sure everything's moving well, make sure nothing's going to create anything else, can be super beneficial.
Absolutely, and I'm definitely in that camp of maintenance. We have this system where you at least should be going to your dentist, 2 times a year for checkups. I know we don't all do that, and same with your medical doctor, at least once a year for an annual checkup. Why are we not doing that with movement, and with our bodies as far as rehab goes? And it goes back to this whole thing. It's like, do diets, I'm putting that word in quotes, typically work? No. Do lifestyle changes work? Yes, absolutely, right? It's typically not just this, I go in for whatever, I eat right for a week and I'm good, or a couple weeks. And the same thing happens with our body. And I know it's a couple different points, but we absolutely, if we want to keep moving well, we have to make sure our machine is well oiled.
Absolutely. And it's really interesting because I'm like, okay, as you're talking, I'm thinking about this. I'm like, how did this all start with dentists? Like, when does this all start as far as like twice a year? Like, it's just a normal thing. It's what we do. And the insurance companies are kind of under the same belief because obviously, like, insurance pays for those 2 cleanings a year. If you have insurance, I don't. So I pay out of pocket. That's beside the point. But so it's like, everyone's definitely bought into this system, and I don't disagree with it at all. Like, we want healthy teeth. So I'm like, how do we, other than just talking about it more in these avenues, like, how do we get a system created where it's just normal to do that movement check-in twice a year, quarterly, whatever it is?
Yeah, I think that's the $1 million question, so to speak, because yeah, we definitely don't have that. I think one, we should reverse as a profession in our physical therapy profession. And if anyone's listening, please reach out and help us help y'all. If you're involved in the APTA or whatever bodies there are, is advocating for that and showing what you and I have shown and can demonstrate in data, that when people are doing these check-ins, they are hurt a lot less, right? Or the magnitude of their injuries are a lot less. So, we need to then go to the insurance companies and be like, see, this is going to save y'all money because that's the only way. I'm sure they found with routine cleanings there were less $50,000 oral surgeries. So, and I know that's a conversation for like another time, getting a little existential here, but um, I think it all starts with what you are doing and why it's so important. What I'm doing, why I feel it's so important is setting that intention with the people that were within our reach.
Yeah, absolutely. Absolutely. And I think tying into some of this is kind of what we also wanted to bring up today is the whole concept of you can't out strengthen bad patterns, bad movement, compensations, things like that. Time and time again, we see people who have an issue, so they just start to do strengthening, or maybe they're working with their therapist and they start doing strengthening. But no one's actually looking at it's like, you know what? Every time you say toe off, you are rotating in your hip because you are lacking ankle dorsiflexion or whatever compensation is there. And like you can strengthen all you want, but unless you break down that habit that your body's stuck in, you're just essentially strengthening poor patterns.
Yeah, it's something that I see a lot. People just think that they can just outlift their their injuries. Oh well, it hurts when I do 225. Maybe if I do 235, it'll get better. Or maybe that's the advice they're being given, and all that. It's like, well, maybe sometimes I'm sure there's some cases where that happens, but generally no, because there's an underlying dysfunction going on in their shoulder blade or like whatever that's keeping them from maintaining that whatever position when they bench press and now you're contributing, you're kind of moving like towards bad by with that mindset as opposed to towards good or away from bad.
Hmm. Absolutely. Do you, where do you think, and I guess it could be a lot of things, but where do you think the disconnect is there as far as um, why we just continue strengthening and not looking at those other things that in how someone's moving?
Yeah, it's a great question. I think a lot of it is kind of habitual. That's kind of how we, especially as Americans, like to get through things is by doing more, just adding more into the system and hoping, you know, something happens. I also think that because most of our people, at least I can only speak for myself, are working with their trainers and stuff like that, and that's the methodology and all of that with their trainers, and so they're given that kind of advice. But what we find is when we are work in conjunction with their trainers, they have this whole different lens. It's like, oh my gosh, so this is happening not because like we need to strengthen this, but because this other thing, serratus anterior is not working as well as it could. And it's not always strengthening, that we have other aspects of, I know I'm getting long-winded, but neuromuscular re-education. We can work on the nerves to help with the input to the muscles, and there's all these little facets that could be contributing to what's going on. But I'm really interested to hear, what you think, on your end with your population.
Yeah. Um, I think there's a couple of things going on. One is almost like we said before, like just chasing pain. I think so many um just practitioners just like see that pain, they know the person wants to get out of pain, they address that pain. Okay, cool, the pain's gone, problem solved. And don't really necessarily look any deeper to see what movement patterns might be creating that. Um, but I think too, there's like there's some like personal trainers, coaches, like they know what they know their stuff for sure. What they don't know a lot of times, and there are some really good ones that do understand it, but what they don't know a lot of times is those intricacies of movement. like I've worked with a number of coaches who had shoulder stuff going on, shoulder injuries. And it's like we cleaned up a little bit of how that whole shoulder blade area works, how it's controlled, and things go away. So I think a lot of times it's not that anyone's bad, it's not that anyone is uneducated. It's simply it's like we know what we know, and we haven't necessarily gone out of that scope of what we know, which is why all of us, I think, have to work really well together in order to really, work as a team in order to really help people solve their problems.
I love that. That's so well put. And and with the trainer kind of PT collaboration, what I always like to say is kind of like, my goal is to work on that on a super microscopic level with the client, getting that glute working, getting the whatever working, so then you can train them as a whole. And trainers can go micro, with stuff as well. But I really want to get that muscle functioning so that you can build this person up and help them optimize their performance. Or maybe I'm gaining the range while they're training the range. There's this great collaboration, assuming the people who are willing to, between us, because it's all for the betterment of the patient, right, or the client. It's not about me. It's not about marking territory or any of that stuff. It's 100% about it's client-centered and client-focused.
Absolutely. And to be honest, I love working, not that I love that coaches get injured, but I love working with them because especially then, like I'll see them instructing other people, like with the cues that I use, or not necessarily with the same cues, but like helping other people, other athletes, like to move better. And I'm like, and that ultimately, like, that's my goal. I know there's millions of people in this world. I can't help them all. There's billions of people actually in this world. I can't help them all. Like, let me teach other people by helping them, like, so they can help other people. So like, that's what I absolutely love is being able to work with some of those coaches and trainers from a client standpoint in order to really like teach them how to help other people better.
It's absolutely wonderful. And just like vice versa, I like training with strength coaches and stuff because they'll have some cues and stuff, get out of the hole, get in the pocket, like that kind of stuff. Ooh, that's good. And maybe not for this particular cue of Olympic weightlifting or something like that, only lifting, but I can take that into help my clients in a different way. So again, it's all about collaboration. It's all about a growth mindset to help this injury cycle. The other thing I like about working with our trainers is typically our trainers have been seeing my clients at least for a lot longer than I have. So I can gain a ton of insight into movement patterns. And like I said, it's just with a different lens. And I'm like, oh, okay, what they're saying is this. This sounds like to me this, and on we go.
Yeah, that's so true too, is because by the time we see them, for the most part, they've been working with someone else for a while, and being able to have that insight is really helpful.
Yeah. But what you said in the very beginning was like that injury cycle. And the only way you can get out of a cycle of any kind is to really, really break it. And by doing the same things that you have been doing or trying to out-strengthen the bad habit, likely hasn't worked in the past and is probably not going to work in the future. So we need to, just take a pause, take a deep breath, and critically think about it. Because I think when we do, and I'm sure everything we're saying makes so much sense for everyone listening. It's like, oh yeah, well, duh. But really implementing that. How do we do that, right?
Yeah. And I think I want to take a little step back before we talk about how we implement it and talk about why these patterns even happen. Like, why are we restricted motion in certain areas? Why are we stuck in the patterns that we are, rather than like the body should just know what to do?
I blame Netflix.
You blame what?
Netflix. just playing Netflix. Don't pull brands. No,
Oh my God.
totally kidding, totally kidding.
Oh
There's not a
no.
single there's not a single cause to any of this, right? But it is, you know, they did a really cool study on low back pain. I'm sure you've seen the graphic before. They, EMG'd, which is putting a probe into someone's lower back. Good on them because they're better than I. I would never do something like that. But and then they measured different postures. You know what I'm talking about? You know the study I'm talking about.
Yeah.
And they had the person slumped at their desk. They had someone standing. They had someone kind of slouched over while standing. A bunch of different positions. And they found that someone who's slumped sitting, and that's that kind of 5 o'clock posture for everyone listening right now. Where you're just done with your work day and want to get on with it with your day. And they found it was like 2.5 to 3 times your body weight is put on your lower back in that position. And so not that any of these positions are good or bad, but sustaining these positions for a long time, I personally think are the biggest contributory to our dysfunctions.
Yeah, sustaining positions. And I think too, like it's still sustained positions, but I think like thinking about those things we do every single day that we don't realize we're doing. Like if
Mhm.
you are someone who is like every time you're standing, you're shifted onto your right side. Or when you are like anything you're doing, maybe in your kitchen, you are always rotating to your right. You're never rotating to your left. So we get like locked into these patterns. Like these are even if you are working to, even if you are doing the things to like fix the patterns, which you will talk about in the how, but but you're living the other 20 some hours of your life in these patterns, you're still not going to fully break things down. So it does take some assessment and thinking about like these things in your life, the things that seem totally normal for you to be doing every single day that don't seem odd at all. And really starting to analyze like, what am I doing on a daily basis that might be contributing to some of these issues?
Hit the nail on the head with that. Yeah, it's and this goes back more to habits, right? What's our habit?
Yeah.
If our habit is every time we reach overhead after unloading the dishwasher is with putting the dishes up with our right arm, we have this habit, right? And we're going to develop these imbalances, and that's obviously a super small scale, probably fairly insignificant. But now we have that preference of reaching up every single time we want to get something else, and now you're doing that 40 times a day on your right side and not utilizing your left side. Now we have this significant imbalance.
Yeah.
So yeah, I think that's a nail on the head. Habits. So we can cut that part out, right?
We can. Um, something else I was reading, I saw this research article maybe 6 months ago now, and it kind of, I wouldn't say I wasn't looking for verification on anything. I was actually looking for something else, but it did say like one of the biggest reasons of re-injury rates is incomplete rehab following a previous injury. So I think this is a lot of times where we get our like compensation patterns and things like that from, because like going to an ankle sprain just because it's one of the easiest. It's like we've all turned an ankle at some point in our life, right? And it's like, okay, things feel great, balance is back, strength is good, we're back to doing things. But maybe that ankle dorsiflexion, that those toes coming up towards you motion, hasn't quite fully restored. So then every time you toe off, you're rotating that leg slightly outward to the side. So we can aggravate like anything up that leg into the back area. So simple things like that too. Not fully getting all those compensation patterns corrected when you are in therapy from an injury is another huge reason that a lot of these patterns develop, I think.
Which further necessitates that whole idea of, these check-ins and that kind of stuff, you know, periodically, because yeah, I mean, I think that's the age-old thing with rehab is that we're really, really good traditionally at getting people back to like 70% of what they were, like really good. But the ultimate goal in my eyes, and I'm sure in yours as well, is not to get someone back to 70%, but to get someone to 120% of where they were.
Hmm.
And I don't necessarily mean that 120% of range, because that's probably not healthy either. But
Function.
I know you're probably thinking the dorsiflexion right now as I was when I was saying that. but um, but we want someone to be not only healed, but resilient and optimized.
Hmm.
And yeah, so I mean that's a huge point. I thought
Yeah.
that you brought up.
And I think it's important to note too, like anytime we develop these compensation patterns, or like you're talking about reaching up into the cabinet, like our body and brain are great at making those seem or become normal to us, in quotes. And so it's like these things you're doing, they don't even like you don't even know you're doing them because the body has just ingrained these as normal movement patterns. So it's not something that you can easily, unless you know movement, then you can film yourself and look at things. It's not something you can just be like, oh, this is what I'm doing. Okay, we need to fix that.
Yeah, it has to get pointed out. And I mean, even with me, like I understand movement fairly well, getting better every day. But when I meet a high level strength coach, who's in my network, or and I mean another practitioner, they point stuff out to me with how I move, and I shift the weight too, and all of that, and I'm like, oh wow, thanks so much for bringing that to my attention. Now I can start working on it,
Hmm.
right? Whether I do or not is another story, but but that's a me thing more than anyone else thing.
Right.
um, so I mean, we've said it over and over again on our talks in the past. It's about getting that team and those people who are invested in you, get that circle around you, so that you can you know be moving as well as possible. And let me say one more thing. There is no, from my eyes, of course, there's no such thing as perfect movement or normal movement. We
Hmm.
all have our asymmetries, we all have our preferences, we all have our stuff. And and for a lot of us, we have our preferences and there's no dysfunction, and that's fine. But for some of us, we have our preferences and there is a dysfunction. And so we need to make sure we understand kind of what camp we're in. And
Yeah, and I think that's definitely important to point out. Like, and I was talking to someone again recently who was like, there's no perfect movement, but there's optimal movement for each person. Because we all have our histories. Like, if you've fractured something and destroyed a joint and like that joint's never going to move properly again, well, we probably are going to have some compensation issues. We can only get so far. But there we can still get optimal movement for each individual person based on their situation.
yep, yep. And so yeah, and I guess kind of summarize that, like there's no perfect movement or textbook movement, but there is ideal movement, and typical, movement and all that.
Hmm.
Like I say sometimes is like, hey, I don't have shoulder problems yet, anyways, and so this is obviously a snapshot, in my life right now. So it doesn't really matter how I reach for something. It really doesn't for me right now. But for the person with the shoulder problems, yes, you do need to think about how you do it. I need to think about back stuff, as I share with my, every time I drop a pencil and lift and think about how I'm going to pick that up. It has to be a volitional thing. I have to really, really think about it. So other people, doesn't matter. They can lift however they want. They might not ever get back pain.
Yeah, that's a very good thing to point out. So so we know we have these patterns. We've talked about how they're formed. We've talked repeatedly that we can't out strengthen these bad patterns. So what do we actually have to start doing to correct these patterns that are going on?
Yeah, that's the That's a great question. The how, and obviously we're speaking generally here, is first of all, identifying a problem, or something that could be leading to the problem. And I like the whole idea of I think PT is nothing but part tasking something and reverse engineering stuff, right? Figuring out why that could be a problem, breaking it down at the micro level, and then implementing and building that back up, right? I say the rehab process is a fairly simple thing. Figure out what someone can't do and figure out how they can do it. How can do it again. And obviously you can get very complex with it, but I think as far as the how generally, that's how I approach things.
Yeah, and
How about
I
yourself?
yeah, for the most part, as a general, I would agree. I think the biggest thing is like I said, the movements, or like I said earlier, the movements you're making feel like they're normal. So when we start retraining things, it feels very weird and abnormal. So then once again, the body's like, I don't want to do this. This is not right. Um, which is why for me, it's very important to have people like move with purpose and really be present with what their body's doing through the exercise. Because if you move quickly through anything, your body's going to go into your compensations. If you move very purposefully and are really present with what your body's doing, you can, one, make it do what you want it to do, not what it wants to do. But two, like anytime I'm working with someone and specifically working to retrain the movement, I'm like, what are you feeling? What are you noticing? Because the more
Mhm.
awareness we can bring to like, oh, well, this is firing. I'm feeling more pressure here, bring awareness to what the body's actually feeling, the better our brain can make that connection to like, this is what I'm supposed to be feeling. And we can bring more aware of like, oh, in the middle of the day when I'm walking, it's like, oh, my pressure's not where it's supposed to be on my foot. Okay, let's correct that. And I think like just having that bigger awareness as far as like what I'm supposed to be feeling and what I do feel can be really impactful for people.
Huge, absolutely huge. Like that idea of body awareness, and yeah, I think that's absolutely perfect, because when we identify that there is a problem with somebody, they are like, oh, I didn't know that I did that. Cool. Okay, we'll pay attention to it. They start paying attention to it, and what I absolutely love about the rehab process is we're a couple weeks in, and they're starting to notice stuff, and maybe they came in for shoulder pain or something like that. They're like, hey, I now notice, like, when I lift from ground to overhead, my back really kind of does something a little wonky, or oh, my hip feels a little whatever. The whole system starts becoming more aware when you have them focus on the primary injury
Mm-hmm.
area. That's what I found. It's so cool to see.
Yeah, absolutely. And I love that. And kind of, I always get it, I do a lot with the feet. So I always get it feet related, but it's just like, I realize like if I'm standing at my desk and my pressure's on like the outside of my feet, all of a sudden later in the day, they'll start hurting. But if I'm more aware and they're like where they're supposed to be, I don't get that pain later in the day. And so like just little tweaks like that, and that awareness can be huge for people. Um, the other thing that came to mind as you were talking about, finding those other things or being more aware is as we start correcting these patterns, even like what we thought was the root cause of things sometimes fades away and we start finding those other things. So it's like, okay, rib cage is moving better, shoulders moving better, but all of a sudden now, yeah, we're finding, what, the back just wants to arch every time you do this, or the hip doesn't quite want to rotate. And so we start like just kind of like peeling back the layers of the onion and really diving into like where is the like ultimate cause of this thing.
It's so cool, and probably one of my favorite parts of what I do is um, is really increasing that body awareness and peeling back the onion. And because what the other thing we're focused, or we're fostering with our clients, is the idea of autonomy,
Mm-hmm.
right? because they are more aware of their body. It's not me just telling them, no, don't shrug, no, don't shrug, no, don't shrug every day, where they're reliant on an external cue. They have these internal cues now as to what they should be doing, what they have been doing, and why maybe, the former is better than the latter with that.
Yeah, and I still remember several years ago, or a couple years ago, I got a message from a past client of mine, and she's like, "Hey, I've been dealing with, I've been getting some IT band stuff." She goes, "This is what I've been doing lately. Do you think that could be related?" And I was just like, "Yeah." She's like, "So if I start doing X, Y, and Z, like that should help calm it down." Yes. So I'm like, I love, like, that's what I want with people. Like, I don't care if they message me later just to confirm, but the fact that they can like think through things and process and be like, "Oh, this is what she taught me before. I think this is all I need to do." And we can like correct what I've caused. Um, like that's what I love. I love people feel empowered and really understand like how the body moves, what they may have done to cause an issue, and then what they can do to counteract that.
That is so cool. I love that story. And yeah, so that person came in just confirming with you, and they were already on the right track and all that. And so who knows, it might need a tweak or two, but they're there, and they already have a master's degree in their own body when before they had a middle school degree. That's so cool. Because I mean, right? It is kind of like school, right? I mean, what we're educating the patients. I see myself as nothing but a teacher. I'm just teaching you to become more aware of yourself
Yeah, absolutely.
and,
Absolutely.
and uh, the great things that happen from that. It's so cool.
Yeah. It's like I do a lot of virtual work. So obviously that's all just education and teaching them verbally how to move their bodies better. Um, in person, yeah, you and I both do some manual work, but yeah, the majority of what we do is truly just education in different different manners.
Yeah, yeah, and that's cool because circling back to this whole we want people to come in maybe for some ongoing stuff but not being reliant on us. I mean that's really the only way we can foster that, because if we you know give them a $20,000 modality that we have here in the clinic and they have to be on it, and the only way they can feel good is when they use that modality, and most people can't afford that in their own home. Now they're reliant on a thing,
Hmm.
which doesn't make them self-reliant. And sometimes that's indicated, obviously, but most of the time it isn't. It's just a little bit of body awareness and education, some teaching. I have the roadmap, and I'm giving it to them. They still have to kind of go on that journey. But when they get to the other side, it's so cool to see.
Absolutely. I love that. And that's a good way to describe it as far as the roadmap or the GPS. Like we can tell you where to go. We can't, I can't physically get you there, but I can teach you
Help you
and show
along the
you and
way.
guide you how to get there.
Yes, exactly, exactly. You gotta ultimately find that pot of gold, and I think that's what really differentiates us from some of the other professions is that um, that we're not doing things to people. We're helping them do it for themselves.
Hmm.
If that kind of abstractly makes sense for those listening.
No, I totally get it. And maybe that's where some of the disconnect is for you and I and with physical therapy, is because I think a lot of, like you said, like the modalities or the hands-on work, like that's how a lot of therapy is done, especially when we're chasing that pain and trying to get rid of pain. Um, and so there is a lot of that, just like hands-on, let me get you out of pain. But I think there needs, and like you said, there is a place for that. There, it is indicated at times, but we need to transition then to the like, all right, I've got you out of pain. Now let's teach you and like teach your body how to maintain this and stay out of pain.
Yes, yes, exactly. It's such a simple kind of concept, but I do understand and see how that can be overlooked by people. And yeah, it's the overall aspect. What do we talk about every word? I think we use the F word every single time we're here. Not that one, the other one. Function, y'all. um, overall, we need to get people back to function, and that can only come from my eyes, and I'm sure yours, through them learning movement corrections and how to get out of their patterns in order to break their cycle.
Oh, absolutely. And I mean, okay. Well, let me say this. Not that you can't get back to function just by getting rid of pain, because you definitely can. But the question is, how long can you maintain that function
Hmm.
before it comes back?
Yeah. And so we should look up the strict definition of function. I doubt there is a temporal. That's a good distinction, seriously, because I doubt there's a time component to the definition of function. But function, how people probably want to get to, it's a long-term thing. People don't want to keep seeing us for the rest of their lives. I would have to guess. You're a wonderful personality, Brian, but I'm sure people don't want to.
Thanks, Matthew.
see you 6 times or 5 to 6 times a week for the rest of their lives.
I don't need to see him one that often.
Nobody.
Oh my gosh, that's funny. Any time's kind of running out here. Any closing thoughts from you today?
I don't have any words of wisdom right now, but no, I think we hit the nail on the head with with this kind of stuff. We need to always be looking at is what I mean, in all aspects of life, is what I'm doing working? Is it leading to improvement in whatever aspect that is in our life? And if it is, great. Let's keep kind of going towards that road until it's not. But if it isn't, we need to make an adjustment, right? Let's talk about it financially. At the end of each month, you have $10,000 of credit card debt, and then you're scrambling to pay that off. Okay, maybe you shouldn't do that again the next week, if the next month, if you can, of course, avoid that, right? Money is a great way to put things into perspective with people, because no, I'm not doing that again. But the same exact thing happens with our body, right?
I love that that analogy there, but also if it's not working, especially long term, like, don't continue it. Find a better solution.
Find a better solution.
Awesome.
Get help.
Yes, exactly. Don't try to keep doing it on your own.
Yeah.
Well, Matthew, if someone wants to, in case they have missed all of our previous conversations, which I'm not sure how that would have happened.
Absolutely not.
Where can people find you?
Yeah, definitely check out all of our previous conversations. I think people who are insightful and looking to do better by their bodies, definitely check that out. But if you have any questions, concerns, criticism, all of that kind of stuff, please reach out to us at Autonest Physical Therapy. You can find us on all social media. Our Instagram handle is Autonest Therapies. You can also find us on Facebook, where I'm a little bit more active. But yeah, please reach out. I love healthy discussions about this kind of stuff, whether you agree or disagree.
Awesome. Thank you again for chatting, Matthew. Always a fun time.
Thanks so much, Brianne. Always a pleasure. I appreciate you.